Hi, and welcome to the Math Update Training. This is part of the August Update Training, and we're going to be talking about how to compare Medicare Advantage plans. So you'll need a couple tools to do so. The first thing that you will need is you're going to need to access Medicare.gov. Then the next thing that you're going to need is you're going to need some kind of comparison sheet. So there's a couple tools that we have. The first is available on Ship Tools. If you log in and go to the Resource tab, and then go to Section 3, Counseling, Outreach, Reporting, Publications, Website, and Other Resources. Click on that little plus thing to expand it. And then go to Counseling Resources. Then we're going to go to Topic 1, Medicare. And then you're going to click on the Medicare Option Compare tool. So when you click on that, this is what it looks like. Now, you can use that, or there's another compare tool that was included in your packet, and it's like this. So again, you can use whichever option you're more comfortable with, and I'll kind of talk you through each of these. So comparing Medicare Advantage plans, it's an art and a science. Okay, so there's some flexibility, and I'll show you two ways to do it. The first would be utilizing this Medicare Option Compare Plan tool that's available on Ship Tools, and then this other way to do it is utilizing the Medicare Options Comparison document. This is actually the way that I do it more frequently, but there's no right or wrong way, as long as you're entering into this a dialogue and having the beneficiary think about cost. At the end of the day, we are only as good as the information that's provided to us, and it's the beneficiary's responsibility to kind of assess these costs. We're here to help them through that process, but we don't make decisions for people. So here we go. So either way, what we're going to have to do is we're going to go onto Medicare.gov, and we're going to start using the Medicare Plan Finder. Now, the Medicare Plan Finder, in the purposes of comparing Medicare Advantage plans, it's a good tool to access information, and it can start the analysis, but it does not do the analysis for us 100%. So you're going to go to Find Health and Drug Plans. Now, I'm going to go through the Medicare Plan Finder section rather quickly. If you do need help utilizing the Medicare Plan Finder and you need more information than what's provided during this tutorial, I invite you to go and on Medicare.gov, there is this Plan Finder tutorial that'll take you step by step. It's a great video if you need it. So I'm on the Medicare Plan Finder. You can do the general search or the personalized search. I'm going to do the general search because I don't have a beneficiary's information with me. You enter the information. I'm specific to that person. I'm going to say that this person doesn't have Medicare coverage yet and they don't get extra help. And I'm going to continue to the plan results. This next step is where you enter your drugs. again, I'm just going to whip through this and say somebody takes Lasix and they use the generic, and maybe they take metformin. Again, you know, I just want to get something in there. So my drug list is complete. I get to select a pharmacy. I'm just going to click CVS pharmacy and go to continue. Now, when you get to this section, we want to look at Medicare health plans with drug coverage. This top section here, the prescription drug plans, that's for Part D plans, so we're not looking at that in this exercise. And Medicare health plans without drug coverage, we will hardly ever want to enroll somebody in these, because if somebody needs a Medicare Advantage plan and they also need drug coverage, they should be getting it all in one plan. So somebody should be getting their drug coverage through the Medicare Advantage plan. They do not want to join a Medicare Advantage plan and then join a Part D plan, because that will kick them out of one or the other. Okay, so they have to get their drugs through the Medicare Advantage plan. Now, the reason why this without drug coverage is even an issue is it's there because people who have veterans benefits and get their drugs through the Veterans Administration, those people also can join a Medicare Advantage plan, but maybe those people want something without drug coverage. So here we are, we're going to choose Medicare health plans with drug coverage. I'm going to continue to the plan results. Now, up here is my current profile. It carries over my zip code, the current coverage, subsidy, the drug list ID, and the password. It's a good idea to jot this down so you don't have to re-enter it in case there's you know, internet issues or the system crashes. It's been known to happen. This will put the person's current coverage up at the top. So we indicated that this person is going to be new to Medicare, so it's putting original Medicare at the top. And then if we scroll down here, here are the plans with drug coverage. Now, when we're looking at Part D only plans, the plan that's at the top is the cheapest plan for somebody in most cases, right? So it does the math for us when we're looking at PDPs. However, when we're looking at Medicare Advantage plans, this Medicare Plan Finder does not do all of the math for us. It's ordering the plans in order of the estimated annual drug cost. So, I'm sorry, the estimated health and drug costs. So what it does is it takes the drug costs, which are a known entity, but then it also takes the estimated health costs for somebody with good, who's considered in good health. And that estimate may or may not be true for that person. So this is a good starting place to help evaluate plans. But the Plan Finder doesn't know a lot of things, right? The Plan Finder doesn't know the person's preferences. So sometimes we talk to people who prefer HMOs. Sometimes people don't want HMOs. They only want to look at PPOs, right? Well, this Plan Finder doesn't know that. This Plan Finder also doesn't know if the person's doctors are in network with these particular plans. And it also doesn't know the person's health history and the types of services that they're going to be utilizing. So, again, this Medicare Plan Finder results are a good part of the analysis. And if we don't have a lot of information on the person, we would be fine to give this person information about the top few plans for them to decide. But if we are able to get better information, then that's what we want to do. So I'm going to go over to this Medicare option tool, right? And we're going to look at the first way to look at these plans. So again, this is the tool that's available on Ship Tools. And so we can start filling in the blanks with this, right? So we can start, filling in the blanks that this is what somebody with original Medicare only would pay. And so we would enter that Part B deductible, right? The 1 3-day hospital stay, right? That somebody only has Medicare, they would pay the $12.88 deductible. Primary care physician visits, right? They would pay 20% copayment. So, if we scroll down, it gives us some guidance there. The primary care visit cost is about $100 per visit. And if the beneficiary has 3 appointments per year, right, then it would be $20 each time because the Medicare beneficiary pays 20%. So 20% of 100 is $20. And if the beneficiary has 3 appointments per year, 20 times 3 is 60. So we can start filling in that. So let me get the PDF version and we'll start filling in that tool. Let's make this bigger so I can see. So the Part B deductible, that's $166 in 2016. 1 3-day hospital stay, well, that's $12.88. Primary care visits, so if somebody has a primary care visit, right, we said it's going to be $100, so that's $20. Let's scroll down. A specialist, they're looking at $200 per visit. So, if we do a little bit of math, that's going to be 20% of the $200 is $40. And so, so per visit. And so we can add up those costs, right? So this 166, the 1288, plus the 20 and 40, and that's 1514. Now, we can do this. There's some flaws in this methodology, right? It's, are these the only things that somebody is going to be using? Yes or no? There's that Part B deductible. Was the Part B deductible used as part of the primary care physician visit or the specialist visit or the hospital? We don't know. So the best we can do is kind of with this particular methodology is to kind of guesstimate, right? So the total annual cost for the services is roughly $1514. The total monthly cost, well, original Medicare for most people is $104.90. So now here's where you can look at the annual cost for the Part D prescription drugs, right? And plug that in. So we'll go back to that part. We actually will do that now. So in this model, so if this person only has original Medicare, well, they're going to, and they are getting a Part D plan. Let's go back to refine their plan results. Select prescription drug plan. Go to plan results. And the cheapest plan for them is the Silver Script Choice. So here's what it's asking for the annual drug cost. Wow. Those annual drug costs are, based on enrollment today, $114.76. So we'll enter that in here. And then the total monthly cost. And so, again, let's go back here. The total monthly cost, I'm gonna for this exercise, the total monthly cost, it depends on how you're talking with it to somebody, right? You can use the $26 monthly premium in that figure, or you can talk to them about their monthly premium plus their co-payments and use $29 a month. Okay, so it doesn't matter what you use, right? As long as you're explaining it correctly. And some of you may feel more comfortable using, the $29 a month, that's saying, like, in this plan, you're going to be paying a monthly premium plus a copay, and that total will be $29 a month. You'll have $26 in premium, roughly $3 in copayment, and that's what you would pay each month. So I'm going to use that. Some of you might want to put total monthly cost as the monthly premium. Again, this is a pretty flexible tool, but you're going to need to explain whatever you're explaining correctly. So that's what the traditional Medicare only option looks like. Let's go back and let's look at a Medicare Advantage plan. Okay, so I'm going to go back to refine your plan results. I'm going to go back to the Medicare health plan with drug coverage. And we're back to looking at this, right? So, again, Harbor Health Medicare is the first plan. So let's look at the details of Harbor Medicare HMO. So when we look at this, there's a few different tabs on the Medicare Plan Finder. The first is an overview. Now this overview lists that this plan has dental, vision, and hearing coverage. It's an HMO. It has the contact information and then the star rating. So this plan is too new to be measured. If you scroll down, it tells more about this plan, right? It has the overall star rating, too new to be measured. It has the service area, and it has the plan website. So if, when we're looking at this plan, there's a question that we can't answer, it's a good idea to go to the plan's website because there might be some documents that further explain coverage rules. Or important note, this plan does not charge an annual deductible for all drugs. The $240 annual deductible only applies to certain tiers. Good information. And then here's where we can look to see if a provider is covered. There's their network listing. This also lists how an independent sales agent or broker would be compensated. All right, and so under this overview tab, it lists some costs based on national averages. So these are all estimated based on somebody with relatively good cost or good health. So somebody in good health, they would still pay the Medicare Part B premium of $104.90. For this plan, there is no premium, so they would not pay an additional monthly premium for this particular Medicare Advantage plan. They're estimating $30 in inpatient care, outpatient prescription drugs, $398, dental services, $22, all other services, $74. So these are the estimated costs. Now, this is a good jumping off point. However, this is not talking about what services an individual would look at. So most people don't care what national averages are. They care about how it's going to, what it's going to cost them. So I like to go to the Health Plan Benefits tab and look at what the actual costs are. And you can see there's no, again, no premium, no health plan deductible. There is a prescription drug deductible for some drugs. It has a $3,400 in-network out-of-pocket maximum, meaning that this is the most somebody would pay in co-payments for healthcare services under this plan. The out-of-pocket maximum does not include prescription drugs. You have to, it's an HMO, so you have to use the plan doctors for most services. Now, here are the benefits, right? If somebody goes, needs an ambulance, it's going to be $175. It's a $10 co-payment for a primary care doctor, $45 for specialists. Durable medical equipment is 20% per item. Emergency care is $75 per visit. Nothing for home health care. It's covered, but the plan will pay at 100%. Mental health care, outpatient hospital is $200 per visit. That would be like, outpatient surgery. That would be maybe somebody's in observation status. Dialysis is $20 per visit. Inpatient hospital care is $245 per day for days 1 through 7. And the skilled nursing facility is $0 for days 1 through 20. So this is where I'll have a conversation with the beneficiary. And I'll ask them, right, about what their healthcare history is. Now, nobody has a crystal ball, and nobody knows what the year will hold, right? You can't predict necessarily if somebody's going to get into an accident or fall or, or get sick, right? But what we can do is we can use past healthcare utilization to help make an educated guess about what things may cost based on their past healthcare utilization. So I'll ask them, I'm like, so before we take the next step, before we start talking about cost, can I ask about your health? Can you tell me, do you have any chronic illnesses? And sometimes people are very forthcoming, and they'll tell you right off the bat, I have a history of heart issues, and I see a cardiologist twice a year, and I got sick with the flu last year, so I saw my primary care doctor for that, and then I saw my primary care doctor for my annual wellness visit, and sometimes just cut and dry and very. Sometimes you might have to probe a little bit, right? And there's no right or wrong. We're only as good as the information that people provide us with. However, sometimes we get a feeling maybe they're not telling us everything, or sometimes there's some evidence to the contrary. For example, Now, I was talking with somebody a few years back. I kind of used her as my example because it just kind of is the perfect example of how these things go down. So I was talking to somebody over the phone, and I'm asking her, well, how's her health? And I can hear she's a little bit winded, right? She's huffing and puffing. I can hear some kids in the background, and I say, you know, can we talk about the health? And she's like, oh, honey, I'm blessed. I'm so fortunate. And I'm like, oh gosh, it sounds like you know you have maybe your grandkids over. She's like, oh yeah. I said, it sounds like you're chasing after them and a little out of breath, huh? She's like, oh, well, that's just my COPD, honey. And I'm like, oh, so we have some lung things going on. Do you use inhalers? Oh yeah. And then I'm like, you need oxygen? She's like, oh no, honey, I don't need any oxygen. All right, well, she's like, I have that machine that I'm hooked up to. Oh, the one that you sleep with is the CPAP machine? Oh yeah, honey, I do that. But I have that nebulizer too. All right. She's like, you know, that's okay. She goes, and I'm like, oh, you know, you feel good otherwise? She's like, yeah, you know, sometimes though I have my sugar, you know, my sugar acts up. I go, oh, are you diabetic? She's like, oh yeah, honey. I'm like, wow, you have to test your sugar, huh? Yeah, I have to test my sugar 4 times a day. Okay, all right. So, you know, are you on an insulin pump? Are you? No, I just inject the insulin. Okay. She's like, you know, she's like, you know, so, you know, it's not necessary to be a clinician. I mean, I think some of the questions, you know, I might have asked might be different than you, but you know, if you show an interest in them, and you know, okay, are you sure that's it? Are you, you know, maybe you'll get some good information, but we just do the best we can with the information we have. So based on that conversation, right? Based on any of the conversations, you know, we can do some estimating, okay? And I kind of want to jump to my tool for a second, right? So I like in this Harbor Medicare HMO. Its type of plan is an HMO. Its monthly premium is nothing. So here's where I'm going to go back and forth. So primary care physician copayment. So look here, that's $10 per visit. Now, a specialist copayment, that's $45 per visit. The hospital copayment, $245 per day. And then any other copayments. And this is where, like, you have where that conversation comes in, right? So if somebody needs durable medical equipment, right, this is where you might enter that, right? Or if somebody needs dialysis, here's, or if somebody's planning on having outpatient cataract surgery, that's where you put that outpatient. So it'd be any other services here, okay? And then this is where we go, the annual cost for you. Well, the annual premium cost is going to be nothing for this plan. The doctor's copayment cost, well, let's say she sees her primary care doctor 3 times in a year, right? So we'll do, and I'll go over here and I'll put 3 PCs, primary care visit, and maybe 4 specialists for, so, okay, so I'll have, well, 3 times 10 is 30. And then 45 times 4 is 180. So 180 plus 30 is 210. Any other co-payments, right? So this is like if they're going to get durable medical equipment, or if they're going to go, outpatient surgery is planned, or whatever else may come up. And then we'll take the drug co-payment. So I'm going to go back here, and I'm going to go to drug costs and coverage. And I'm going to look here, and I'm going to say, okay, well, under this plan, she's paying $398 in co-payments each month for everything. So the drug co-payments are $398 a month. So it's going to be like $1,592 a year. So and then total. So under this plan, this person would pay, we're going to add all this up. So there's no premium. There's the $210 in doctor's payment, co-payments, the $1,592 in drug co-payments. So $225.92. Okay. So this is option number one. And then we can do that with the other options under this plan, under this tool, right? And with this tool, if somebody doesn't have a preference, I might do an HMO, a PPO, and original Medicare, a Medigap, and a PDP. Or maybe if somebody wants HMOs, I might do 3 HMOs. Or 2 HMOs and a PPO. So the options are, again, we're person-centered. It's not going to be prescriptive. I don't want to start comparing Medigap if somebody doesn't want to look at a Medigap. But if somebody wants to look at what their options are, it could be a good thing. And then I'm going to skip back, and I'm going to go back to the list, of the plans. So Harbor Medicare kind of came up first. Meridian Prime is coming up second. And so let's check out Meridian. Well, let's do a PPO. All right, so it's Priority Medicare Ideal PPO, right? That's the cheapest PPO for this person. So let's kind of go in, and again, I'm using the second tool for this. So I'm going to type the name of the plan, right? Priority Medicare, Medicare Ideal PPO. It's a PPO plan. It has I'm going to go to the Health Benefits tab. It has a monthly premium of $15. So in the Plan Finder, it has the health plan premium and the drug plan premium, and we're going to add these 2 line items together. So we have 0 plus 15. That's the monthly premium is $15. So we need the primary care and the specialist co-payment. So let's go scroll down just a little bit. So the primary care physician is $0 to $25 per visit, and specialist is $0 to $50 per visit. So, and this is for in-network. So we have a range, and let's kind of go to the upper limit of that range. There might be some primary care physicians in this network that will do $0 per visit, some that will do $25. So it's hard to tell, but let's do kind of the worst case scenario, $25 for the primary care physician, $50 for a specialist, and we're going to enter that in. So 25 primary care, $50 specialist. Now let's get that hospital copayment. Inpatient hospital care is $250 for days 1 through 5. So $250 per day. And in this example, we didn't have any other copay. So the annual cost for this person with this priority ideal PPO, well, the annual premium cost, so that's $15 a month in premium. And if we're talking to somebody during open enrollment, it'll be during 12 months. But in this example, right, we're talking to somebody who's new to Medicare, right? And because we're in August, the first that somebody can enroll in this plan is September. So everything's based on a September 1st enrollment with the Medicare Plan Finder. So let's, this new to Medicare person becomes Medicare eligible September 1st. So we have September, October, November, and December. That's 4 months left out of the year. So we're going to times that $15 monthly premium by 4 months, and that's $60 in annual premium costs for the remainder of the year. Let's see. Let's just put here based on an N1, 16 enrollment. All right, so we have the annual doctor's copayments, and this is based on 3 primary care physician visits and 4 specialists. So for a primary care physician, it's $25 times 3, so it's $75. And the specialist is $50 per visit, and it's 4 visits, so that's $200. So that's 200 plus 75 is 275. In this example, we don't have any other copayments that we're talking about. And then the drug copayment. So let's kind of go back here to the Plan Finder. Let's go to drug costs and coverage. Okay, and we can see it's going to be $13.27 each month. Oops, sorry. This chart. All right. So they're going to be in the deductible period for the remaining 4 months of the year, okay? So we're going to do $13.27, because that's their payment in the deductible, times 4. So the co-payments are going to be $53.08. So the drug co-payments for the remainder of the year are $53.08. So let's add all this up together, right? We're going to add this bottom section up. So we have $60 plus $275 plus $53.08. And that's $388.08. So you can see this Harbor Medicare HMO is cheaper than the PPO. Now, when we're talking to somebody about this, right, there might be other things to consider. Maybe, you know, does their doctor accept both of these? Now, that's a really good question. Some people, right, they're not going to want the HMO regardless of how much it costs. So maybe they're willing to pay a little bit more in a PPO. So that's an idea of what this tool looks like. Now, if we want to add in option 3, right, that would be original Medicare, or O-R-I-G-I-N-A-L, Medicare, Medigap, and PDP, right? Actually, that's the type of plan. So with this, right, we can ask them, what Medigap plan are you on? How much does it cost each? Or what Medigap plan are you considering? Okay, we're going to be a little bit dependent on where the Medigap information they're providing us with, right? So we can enter, you know, we'll just go kind of for the sake of argument that they're looking at Blue Cross Blue Shield of Michigan Legacy Plan C. And then go back to the plan finder. We're going to go back to the refine your plan results. We're going to uncheck the Medicare health plan, check the Medicare prescription drug plan, and continue to the plan results. Now, the cheapest plan for this person is Silver Script Choice, so that's going to be the name of the PDP. Let's go back here. Okay, so the monthly premium, okay, for Medigap is about $123, and for Silver Script, its monthly premium is $26. So let's add that up. 123 plus 26 is 149. Okay. Now, let's fill in those co-payments, right? So Medigap Plan C, right? They have original Medicare. The Medigap takes care of the Medicare co-pays and deductibles. So when they go to the primary care physician, it's going to cost them nothing. When they go to the specialist, it's going to cost them nothing. And when they go to the hospital, it's going to cost them nothing. And then if there's any other co-payments that we need to consider, nothing. So let's fill in that annual cost for you, right? So the annualized premium cost based on a September 1st enrollment, so 140, right? That's the Medigap and the PDP together, times 4 months, and that's going to be $560, right? And then the co-payment annualized, so 3 primary care physician visits and 4 specialists. Well, because they have that Medigap, it's going to cost them nothing. Now let's look at their prescription drug copayment. So let's go back to the plan finder, and let's kind of click into here, the plan details. And let's kind of skip ahead now. We're at that copayment level for the next 4 months. That means they're going to pay $269 per month under this plan. So 269 times 4, that's $10.76. So let's plug that in there, $10.76. And now let's add this whole thing up. So we have $10.76 plus $5.60, and that is $570.76. So you can see, right, I'm looking at like the 3 plans. We have the Harbor Medicare HMO, and its annual cost based on this person's health history would be $225.52 for this Medicare Advantage HMO. We have this Medicare Advantage PPO, Priority Medicare Ideal. It costs a little bit more, but it has a little bit more freedom, so it's $388.08. And then finally, we have Medigap Plan C with a prescription drug plan, and you're paying a little bit more, right? $570.76, but we have that peace of mind that should anything happen, they'll be covered. So this is how you would fill out this sheet. Now, let's go back to that first sheet that we started filling out, right? So we started filling out this sheet, the traditional Medicare only side. We kind of have those costs in. And so this is where you can start filling in the blanks with the Medicare Advantage plan. So the annual drug costs, right? You know, let's say this plan 1 is, we'll do Harbor. At Harbor Medicare HMO. So the annual drug cost, kind of going back to refine your plan results. And I'm showing you both the tools, right? You can either use this tool or this tool. It's whatever you prefer. But I want to show you how to fill out both, right? So we've already filled out the, you don't need to do both with your beneficiary. You just choose whichever tool you want to use, okay? So the annual drug. So here's this other tool again. If this is what you're more comfortable with, then please, this is a tool available to you. So annual drug costs, you would, okay, per Harbor Medicare HMO. Let's scroll down and get there. For the drug costs. So this has like a $0 premium, so I can just, you know, use this $15.92, or I can, this person is going to be in the deductible for the next 4 months, so it's going to be the $398 times 4. So $15.92 is the annual drug cost. 1 3-day hospital stay, let's go check that out. So the health plan benefit, we'll scroll down. So it's $245 per day times 3 days, so that's going to be $735. Primary care visits annually, so in this you can either figure out how many primary care visits that they use, or you can enter in what the copay is. So it's $10 per visit. Sorry, I'm having a hard time with entering it in the PDF. The specialist visit, let's kind of go see what those are. Specialist visits are $45 per visit, so let's go enter that in there. The total health plan health premium, so that was $0. Total annual cost for this plan, let's figure out what that is. Based on the estimate, right? Monthly estimated cost, the total estimated annual cost is $28.20. And then the total monthly cost. So I'm gonna use the total monthly cost with the co-payments, and just like we did here, right? The co-payments for the drugs plus the monthly premium. So there's no monthly premium with this plan. So $398 for the drug. And then you can go and, you know, enter in the stuff for original Medicare, Medigap, Medicare Advantage Plan 2. And you may, again, you may want to use different things, discussions and figuring it, right? You may want to do different math. You may want to, instead of using averages, use the person's actual healthcare utilization for this model. It's whatever feels comfortable for you. The goal in this is to kind of help you feel comfortable with, give you a couple different tools for the basis of comparison. Now, when I'm working with somebody, whether I use this tool or this other tool, I will give them a copy of that. I will also, just depending on the plans that we talk about and what their thoughts were, I'll give them a copy of the plan details, both the drug cost and coverage page and the health plan benefits page. So if we're talking about it and they really like this Harvard Medicare HMO plan, I would give them the details of that. But if they wanted to look at that PPO plan instead, I would give them that information. So really it's kind of whatever that person's comfortable with. If you have any questions, please let me know or let your site coordinator know. Again, I'm not being prescriptive about how to do this. This is just a couple different ways that you can compare Medigap plans with Medicare Advantage plans or Medicare Advantage to Medicare Advantage. Thank you so much. Make sure you let your site coordinator know that you saw this video. And again, if you have any questions, let your site coordinator or myself know. Thanks so much.